In circumstances where a patient has suffered an injury as a result of medical treatment and believes that avoidable errors may have been made, they may wish to consider claiming compensation. If it can be shown that the treatment provided was below a reasonable standard and the patient has suffered an injury or their outcome has been made worse as a result, they may have a valid claim. Our team provides advice in relation to injury and loss suffered as a result of many different types of medical treatment provided by doctors, nurses, and other healthcare professionals, both under NHS and private care.
Every medical negligence claim is different, so we take the time to understand each person's individual situation and how they've been affected. The circumstances under which a patient may approach us with concerns surrounding treatment do vary quite considerably, but examples can include cases where doctors have failed to obtain informed consent from a patient. Typically, there may be a failure to make them aware of conservative options for treatment, in addition to the surgical options and the risks and benefits of each type of treatment. There may have been surgical errors where complications have arisen which fall outside of what is regarded as a recognised and therefore non-negligent complication. In many cases, there can be a failure to diagnose promptly or a wrong diagnosis made, which can result in a delay in much-needed treatment, and the consequences for a patient and their loved ones can be severe and far-reaching. These cases can include delays in the diagnosis of bony injuries, to spinal and heart conditions, blood disorders, and the treatment of cancer.
Although in most cases the injured person will be the one making a claim, it is possible to bring a claim on behalf of someone else. Sadly, we have many approaches from family members who have lost a loved one due to potentially negligent care. In these situations, we will need to explore who has the right to pursue the claim on behalf of the estate and the dependents. This will form part of the initial discussions with any potential client. Sometimes we will be asked by family members to represent them at coroner's inquest. This can be a very difficult and distressing time. If the potential client is under the age of 18, they cannot bring a claim by themselves. However, a claim can be brought on their behalf, usually by a parent or legal guardian, known as a litigation friend. A claim can also be pursued on behalf of somebody who is over the age of 18 but does not have capacity to litigate. A litigation friend may also be appointed in this scenario. We can explain the practicalities of appointing a litigation friend or having someone to support the claim during our initial discussions with a potential client.
There is a strict time limit of 3 years to bring court proceedings from the date of the alleged negligent treatment causing injury or from the date of knowledge of the negligent act, or 3 years from the date of death in fatal cases. If court proceedings are not issued on the 3rd anniversary, then the claim will be statute barred and therefore the client will be prevented from pursuing a legal claim against the potential defendant. In the case of a child, then the 3-year time frame starts from their 18th birthday, so they have until their 21st birthday to begin court proceedings. Limitation may not be an issue in a case where someone lacks capacity to litigate. Every case is different and the investigations required into a client's concerns can take some time. We advise clients not to delay legal action, as limitation can impact on our ability to pursue a case for a prospective client.
The only outcome we can guarantee from a successful claim is monetary compensation. Monetary damages reflect the fact that someone has suffered an injury and will cover any financial losses they may have suffered in the past or continue to suffer in the future. Whilst we understand that no amount of money can compensate someone for their injuries, a clinical negligence claim can help support that person's needs in the future. For example, care, treatment, and loss of earnings may be investigated. Pursuing a clinical negligence claim can take considerable time, but compensation is often needed sooner rather than later. It is sometimes possible for us to obtain an interim payment of damages. This is a sum of money to help with treatment or care needs before the claim has been concluded. Some individuals are not looking for monetary damages, and an apology or changing the way things are done in the future can be of more importance. Whilst we cannot guarantee that changes will be made, we often make such requests on behalf of our clients.
Generally, the purpose of pursuing a case is to put claimants back in the position that they were in had it not been for the negligent care. Some injuries are sadly irreversible, and this cannot always be achieved. However, by getting to know clients and their families and appropriately assessing the nature and impact of their injuries and how they are likely to evolve in the future, we can estimate the level of compensation they can expect to obtain. We will give a realistic picture of what is achievable during our initial discussions. A high proportion of our clients tell us that bringing a claim has been very worthwhile and has made a real difference to their lives.